Hi, and welcome back to Introduction to Public Health. In the next series of videos, we're going to start talking about public health, the healthcare system, and health insurance. And in order to do this, what I'd like to do is start talking about the framework that we use in public health when considering healthcare. And this includes things like the financing of healthcare, so whether that's Medicaid, Medicare, private or employer-based insurance, institutions of care, so where you go to get healthcare, including things like hospitals and nurses and community healthcare centers, how we set healthcare priorities or agendas, the idea of healthcare or health as a human right, and dimensions of equity, and then thinking about health behaviors and conditions in the context of health policy. And so to do this, the first thing I'd like you to do is try to think through some things in terms of how you think about healthcare and what your current thoughts are. So first of all, just take a minute to consider whether or not you believe access to good health should be a right or a privilege. So this isn't asking you whether good health should be a right or a privilege, but should every person, whether they're in the US or elsewhere, have access to good health? And what exactly does that mean? What does access to good health mean? Does that mean having access to health insurance? Does it mean having access to healthy foods? Does it mean access to physical activity and clean air? And remember, having access to health insurance is not the same as having access to medical care. And we'll discuss that a lot more in the next video when we talk about how healthcare is financed and some of the terminologies that we use around things like deductibles and copays and cost sharing. So think about that for a moment. Now I'd like you to think about, should access to health care be a right or privilege, or do you believe that it is? Again, having access to good health and having access to health care are not necessarily the same thing, right? Whether or not you can go see a doctor is not the same as whether or not you have access to healthy fruits and vegetables, or fresh fruits and vegetables. And the last thing I'd like you to consider is, who should be responsible for providing or financing care? So, do you believe that the primary responsibility should fall on the government? Do you believe that that should fall to individuals? Or do you believe that this should be something that is provided by society or community? So thinking about things like charities. And how would that work? So in each of these cases, how does that work? And this really is, these three things are really the heart of the debate in healthcare right now. Okay? What does access mean, and who should provide it? And so the question is healthcare a right or a privilege? And does that depend on the situation? And so I'm going to give you 13 very quick scenarios, and I want you to make a quick judgment, just yes or no in your mind, as to whether or not each of these cases is healthcare a right or a privilege, or is it something else? Is it somewhere in the middle, or is it just too complex? So, gut reaction for each of these. Jim breaks his leg and he needs a cast. Is getting that cast a right, or is it a privilege? Should it be a right or a privilege? Does it depend on who Jim is, what Jim looks like, how old Jim is? We don't know if Jim is a child or an adult. We don't know if he was walking down the street and tripped, or if he was riding a motorcycle. Does it matter? What if Joe is drinking heavily and he develops cirrhosis of the liver, and he needs to be hospitalized to stabilize his condition? If his condition is not stabilized, he will die. Is that a right or a privilege? Does it matter? Does it matter that Joe has been a heavy drinker? Why might Joe be a heavy drinker? Do you care? Does it matter? Joe survives, he's stabilized, and now he wants to enroll in a program to help treat his alcoholism. Should that be paid for? Who should pay for that? Is that Jim's responsibility? Or does society take on some portion of the financing of that program so that Joe doesn't end up going back and being treated in emergency care, which is very expensive. So who's responsible for that? Is it a right or a privilege? Susan has been keeping up with her yearly mammograms as recommended and discovers she has breast cancer. The doctors recommend mastectomy along with chemotherapy. Does she have a right to that? Is it a privilege? And who gets to make that decision? Who decides what the best care for her is? Should it be the physician? Should it be Susan? Should it be the insurance company? Because they're all invested. Susan has survived her breast cancer. She got what she needed, but now she wants reconstructive surgery after her mastectomy. So mastectomy is when the breast and the breast tissue is removed post-cancer, but now she wants to have breasts again. Is that a right? Is it a privilege? Should it matter? Why would it be important for a woman to have her breasts repaired after have reconstructive surgery? Is that different? Is reconstructive surgery after a mastectomy different than wanting breast implants so that you look and feel better? Would it matter if she did not want a mastectomy or did not have a mastectomy, or if this was someone who did not have breast cancer and instead wanted breast reduction? Again, right or privilege, you decide. Jordan has diabetes and requires daily insulin monitoring. He needs an insulin pump and other equipment, which can be quite expensive. Is that a right or is it a privilege? Does it matter if it's type 1 or type 2 diabetes? Does it matter if Jordan is a child or an obese adult? How do you look at Jordan? How do you make that decision? Jenny's depressed. She's currently on several antidepressants, and she would like to see a psychiatrist to help her with her depression so that she's not just taking the medication, she's also seeing a therapist to help her work through. Right or a privilege? Do you consider depression to be a medical issue? Does it matter on how it's treated? I will say mental health care in the United States is not very well covered by insurance currently, particularly depending on the type of insurance you have. Should it be a right or should it be a privilege? Sarah's due to receive her polio vaccine. We talked in the previous video that polio has been eradicated. Does society have an investment in making sure people get vaccinated? And if we do, should we contribute to the financing of those vaccines for individuals? Now we have Sharon. Sharon's having difficulty getting pregnant, and she would like to try in vitro fertilization to help her conceive. Very expensive and time-consuming medical procedure. Right or a privilege? What if Sharon is already pregnant, but she wants to receive prenatal care and counseling? Well, we know that women who go for prenatal care are less likely to have preterm and low birth weight infants. And we know that preterm and low birth weight infants are the most expensive patients to treat in a hospital. So, should her access to prenatal care and counseling be a right or a privilege? Again, depending on what you say, it depends on how much you're willing to invest. Sorry about that. Now Sharon would like to have her child at home with a midwife. Right or a privilege? On how that gets covered and how that gets financed. What about Kara? She smoked for 20 years. She now has lung cancer. The doctors recommend surgery and chemotherapy. Is her treatment a right or a privilege? What if Kara had never smoked and developed lung cancer? Would that change her opinion? Would it matter? What if instead of Kara being a smoker, she had worked in coal mines and had developed lung disease as a result of her occupation? Would that change your mind? And finally, we have James, who's morbidly obese, and he wants to receive gastric bypass surgery to help him lose weight. Should that be a right or a privilege or somewhere in between? Would that change if I said James would like to seek out dietetic counseling to help him lose weight? Where do you draw the line? And so the dilemma in healthcare is that it's all about trade-offs. And so one of the online discussions that I'm asking you all to have are to consider this situation. For $100,000, you can pay for treatment that prolongs the life of a 65-year-old executive by 10 years. Right? So, as I mentioned in the previous video, premature death is anything below age 65. So you have $100,000 there, and you can expand somebody's life 65 for 10 years. Or, for $1 million, you can pay for a life-saving treatment for a 2-day-old baby that will allow this child to live to his or her full life expectancy, let's say 80 years of age. Which one do you choose and why? And this may strike you as an impossible decision, but there is a finite pool of money that we can draw from. And decisions about healthcare, about what's covered and what isn't, and what is vital and what is not, happen every day. And it's happening in politics right now. And so, if nothing else, it's very important that you think about these things and form your opinions and be informed voters. Because what you do at the ballot box influences your health and the health of everyone else around you. So take some time, think about that, and make sure you go to the online discussion page on Canvas and write your opinions. And so thinking about trade-offs, we have what we expect versus what we're willing to accept. And so generally, if we have high expectations from the government, we're going to need to accept more government regulation. Versus if we have no expectations from the government, we may be willing to accept no government regulation. The problem comes in when we have high expectations from the government, but want no government regulation. Right? That's where the problem starts to come in. So let's give some examples of this. Safe drinking water. Generally, we all expect that when we open the tap, we should have safe drinking water. You know, we may pour it through the Brita or the pure water filter, but for the most part, either when we're drinking our water or when we get into the shower, we assume that toxic sludge will not be raining down upon us. And because we expect that, we accept government regulations on water treatment. Not only do we accept it, we really we expect that as well. It's an assumption that this is what's going to happen. Now, we've seen in the news over the past several years, when that breaks down, what happens? And you have things like the Flint water crisis. And in this case, what we had is a high expectation of safe drinking water and safe water. We accepted that there were going to be regulations on water regulation and water treatment, except it did not seem to be happening. And so there was a significant breakdown. What about things like emergency care? Right? We talked about Jim who broke his leg. For the most part, people expect that if you show up at the emergency room, you will be treated. Right? You show up, you get treated, and that's just the way it is. Well, we expect that because we have come to accept that government requires hospital to treat anyone who comes to the emergency room. That is the one place where you are all guaranteed health care. You walk into the emergency room, if it's an emergency condition, they have to treat you, and then you can go on your way. All they have to do, however, is make sure you don't die, right? So they just have to stabilize you. Anything beyond that, if you don't have insurance, they're not required. So we tend to assume that if there's an emergency, if there's something happening, if you're in a car accident and you need to go to the emergency room, you will be treated. If you don't accept that, then what you have to say is, I expect that I don't have to be treated, and lower government regulation. What about medical care in general? What about you need to go to the doctor? You want that vaccine for your child. You have a common cold. You want to go for your annual physical. Well, if we expect some level of treatment on demand, I need to see the doctor, so I want to go, you may be more willing to say the government should mandate health insurance, right? Somebody has to pay for your care. So if you want to be able to access health care, you should be required to have health insurance. That's one way of thinking about it. If you're willing to accept that you can be refused treatment or turned away for whatever reason, then maybe you feel more comfortable with no government involvement in healthcare at all. The challenge or the problem comes in when we say we want treatment on demand. Everybody wants to be able to see a doctor when they need them, but we want no government involvement in healthcare. Sorry, just not happy with that. And so we need to make sure that what we expect and what we accept are actually in alignment. And so what are the overarching goals of health policy? Well, policy is what is supposed to be a rational attempt to attain specific objectives. But it can also be thought of as justification for a policy, for government actions, or a government not taking action. Policy is also criteria that we use to evaluate public programs. So what are the standards that we use to assess a program? And really, when we think about policy, it's very value-laden and value-driven, right? So, and that suggests a more complex array of considerations rather than just one definitive endpoint. Do you die or not is different than the Healthy People 2020 goal of people having not only longer life, but a high quality of life free from preventable disease. And so when we think about the 4 goals of health policy, policymakers seek to promote policies that promote equity, efficiency, security, and liberty. So we can think of these as the 4 corners of a square. The problem is it's nearly impossible to promote all 4 goals equally and simultaneously. So policymaking is really about trade-offs, expanding some at the expense of the other. And so let's start off talking about equity. Equity is basically who gets what, when, and how. So what are your beliefs about equity? So let's think for a minute. In front of me, I have this very large, delicious chocolate cake. And I'm trying to figure out how to distribute it equitably among everyone in this class. So how should it be divided? Should I just divide it into 36 portions and everybody gets a tiny slice? Should I base it on who actually attends the class, who's checking in every day and doing all the things they should? Should it be based on who participates regularly? So those who are the most active in class, do they deserve more cake? Should I only give the cake to people who are earning an A? Is that what equity is about? Or should I give it to those who are most hungry and most in need? And what if some of you just don't even like the cake and so you don't want your slice? Should I then give a bigger slice to somebody else who really likes cake or really loves chocolate cake? So equity is determining who should get a piece of the healthcare pie, when and how. And so you have to think about that when you're trying to figure out how is healthcare distributed. Prior to the Affordable Care Act, about 47 million Americans went without health insurance. And when you looked at that within a year, the number would go as high as about 88 million because health insurance was not static. It's something that you sometimes have and sometimes don't have, which we'll talk about later. And so when we're talking about equity in the case of access to health insurance, which can impact access to healthcare, the question becomes, who should have access? Does it matter how much you earn? Does it matter what your health behaviors are? Should it matter if you're young or you're old? Should it matter if you're disabled or able-bodied and able to work? Does it matter if you're a citizen or an immigrant? Does it matter if you're here illegally or not? So these are some things that you need to consider and that are often considered in the discussions about healthcare and healthcare policy. The next sort of concept in healthcare is efficiency. Simple definition of efficiency is getting the most get the most output for an input, or achieving an objective for the lowest cost. Efficiency, however, is also a comparative idea. It's the way of judging how we do things. So is this better than that? And what are the trade-offs? Right? So at what point does efficiency outweigh equity? And at the societal level, we use efficiency to guide how we choose to spend our money or allocate our resources in order to get the most value. So we can look at something like the National Institutes of Health. Within the National Institutes of Health, there are multiple institutes. There's the National Cancer Institute, there's the National Institute of Kidney Disorders, there's one for alcoholism, there's health equity, there's multiple institutes and centers. And every year, Congress has to decide how money is going to be distributed to the NIH and how much it's going to get. Now, most recently, the budget that was proposed is actually going to cut the NIH budget by several $1 million. So if that happens, which institutes should we get less money? Should it be the National Institute for Heart and Lung Diseases, for cancer? How do we decide? And so what are some other examples in healthcare and health insurance? So other examples would be things like, how do we decide who should get a mammogram and when? So several years ago, recommendations were changed about the age at which women should start to get mammography, which is the test for breast cancer. And that age was raised. So no longer was it women 35 and older, it moved to 40, and then in some cases 45 and older, depending on the organization making the recommendation. And there was quite a bit of pushback, and people were very upset about this. Because what we know is that mammograms are better at finding cancers in older women, but we also know that younger women can and do get breast cancer. And in particularly, there's a particular population that is more likely. And so do we set one rule for everybody? Do we elevate efficiency so that it's a more efficient test? We're not doing tests on women who may or may not need it because they're expensive and they're invasive and they cause a lot of stress. And we'll talk about that later when we talk about screening. Or do we offer it to everyone? But that's expensive, and who's going to pay for that? So think about those things. And so when we think about it, there is an equity efficiency trade-off, right? So if we're going to increase efficiency, we decrease equity, and vice versa. There's always going to be that trade-off. Look, the next corner we're going to discuss is up here at security. Security is also called need. And the basic definition of need is something that's required because it's either essential or very important. And most people believe society should help individuals and families when they are in dire need, right? So you see a GoFundMe, you help. There is, a national crisis, an earthquake, etc. People feel the urge to help. But the deeper question is, how do you distinguish need from desire, and how to preserve a work or merit-based system of economic distribution according to need, if that's what we want to do? And so when we think about things, we have to think about them in terms of absolute need, what is biologically necessary for survival, versus relative need. Right? So needs defined in accordance with what our community standards, norms, and customs are. And the next part is where it gets really hard, if that's not hard enough, and we'll talk about that more, is when do you choose? What criteria do you use in health policy making? Do you use absolute need or relative need? And it becomes a choice about which perspective to privilege. Which one do you think is more important? And again, remember, this all comes back to how does it get financed as well. So according to Maslow's hierarchy, we have some basic physiologic needs, things like food, water, shelter, rest, pardon me, clothing, breathing. We have to do these things. What do those things really need? So we know we need a certain amount of caloric intake to survive, but food comes in many forms, from healthier to less healthy. So, what exactly is it that we need? Likewise, what types of shelter are deemed adequate to fulfill our need can be highly variable. And again, goes back to that idea of in accordance to community standards, customs, and norms. And so relative needs might be things like, well, do you need a car? That might depend on whether you're living in a city that has adequate public transportation or if you're living in rural New Jersey, or pretty much anywhere in New Jersey, let's be honest. What about a phone? What about your cell phone? I mean, is that an absolute need or a relative need? Does it matter if it's a smartphone or not? In today's society, what you need to be successful might vary. You need rest, but do you need a bed? Does it matter if you have a good mattress or a bad one? Right? So relative need. What about medication? What about the types of medication? When you have access to the medication? And so when you look at the hierarchy, you have your things like food, water, and shelter, which could be put here into safety and security, right? So things like they have an influence on your health. Or they could be something that support your physiological needs, and deciding what that means and when it means it. But likewise, if you're talking about employment, safety, security, you might need a car for employment. You might need a car for employment or a phone. You certainly, in most cases, need, at the very least, an address to put down on an application. So we think we know the difference between an absolute and a relative need, but remember, those are culturally driven, right? We have a sense of what they are, but the lines do start to get somewhat fuzzy. And so there's often a security efficiency trade-off. So given what you know or believe about security or a need and efficiency, is it possible to achieve both policy goals simultaneously? Right? So if we meet more needs, economically, we're going to have to be slightly less efficient. So what do we cover under those health plans or government health plans might vary. So if we're expanding security and equity, covering more people for more things, we're going to need to squeeze the two other corners. Which leaves us with this last corner of liberty, which we haven't talked about yet. The simple definition is people should be free to do what they want unless their activity harms other people, right? And so the question becomes, when can the government legitimately interfere with the choices and activities of its citizens? In this country, we hear a lot about liberty, that we're based on liberty, we're a free society, people should do what you want. There's a whole political party that's really grounded in the ideology that people should be as unregulated as possible, right? You're libertarian. And so the question becomes, when can the government interfere with those choices? And when, if ever, should community or social purpose be allowed to trump individual choice? And so some people have a gut reaction to go, never, very little, I want the government out of my business. What I do is what I do. But we already accept that the government and community purpose trump our individual choices, right? So we accept that there are speed limits. I grew up when I was younger when seatbelt laws were not a thing. People hopped in their cars and they went where they wanted to go and almost never put a seatbelt on. Now, most people get in their car and it's second nature. It's assumed you will put your seatbelt on. Why? Because there was a shift and there was an expectation, because the government said, nope, you have to have seatbelts. There are seatbelt laws. There are child seat laws. I did not grow up wearing a bicycle helmet. My kids do. It's expected. We have laws about motor vehicle safety. We have laws about smoking. Again, it wasn't that long ago that you could smoke in a restaurant. I grew up traveling and people would smoke on an airplane. Nobody thinks to do these things anymore. So we do accept a certain amount. What about regulation on the environment? How much should there be? How much should there not be? And when does the basic health of individuals supersede the needs of other individuals? Should they ever? And so what I'd like you to do now is go to those online discussions, answer the 2 questions we already discussed, but also based on what we just went over and the assigned readings, think about what, if any, role should the government play in regulating healthy or unhealthy behaviors, and consider whether your opinion of that varies based on government provision of access to healthcare. So, if the government is providing you access to healthcare, if you are getting your insurance through the government, should the government also be able to put more regulations on your health? Should they be able to tell you what to do and when? So think about that and then come back and we'll get into the next video, which will be about the health insurance system and how that works.